appreciate it. Thank you.
Vandenbeld, please.
Thank you. And going back to my previous line of questioning about some of the organizations, Canadian organizations, NGOs, we know a lot of the staff of those organizations, people who are working in humanitarian assistance in that field, are women. And one of the things that I've been told by some of the women that are working in places like Care Canada and elsewhere is that under the contribution agreements or the contracts that they have with Global Affairs, they are not allowed, the employer is not allowed to fund any top-ups on parental leave. And a lot of these people are working for 10 years or more. They're long-term employees, but because of the nature of the agreement they have with the Government of Canada, they're not allowed to have the same kind of top-ups that other employers might wish to provide, and it's actually precluded. Can you tell me, first of all, if that's true, and if it is true, is there any interest in reviewing that?
So that issue came up, I think last year, and it was, I can't remember the organization that raised it with us, and we are reviewing our policy on that.
Okay, thank you very much for that. The other thing, in 2010, I was managing a global project for women, women in politics, and I had staff on 5 continents, and one of my regional coordinator for Sub-Saharan Africa Skyped me one day and said, "You Canadian women are hypocrites." And I sort of stood back and, what do you mean? She said, because we know that, she goes, I studied at McGill. I know that Canadian women have reproductive rights, but it's not good enough for us African women. And then she pointed out to a clinic in her hometown. It had been Canadian funded for 40 years. It was providing needed medical services in a conflict-affected area. It provided sexual and reproductive health support for young 14-year-old girls who'd been gang raped by militias. And because one of the things that that clinic offered was abortion services, they were actually cut by the Harper government. And that clinic, with almost no notification, after 40 years of working with Canada, they lost all of their health services because of that. What I'd like to know is, how is it that our government now, because we are very, very clear that we support women's reproductive health and choice, how are we rebuilding those broken relationships? How do you go into a village where the doctors lost their jobs, the nurses, the clinic shut down? How do you go back in there and open that clinic and ask them to trust us again? Is there a way that we can restore and rebuild that trust that people had in us, particularly women in developing countries?
I think with the announcement of the funding for sexual and reproductive health and rights, as well as the broadening of the definition of maternal, newborn, and child health, our development officers overseas, the ones that we have at headquarters, and our partners have been very active in the communities and countries in which we work to rebuild that trust and to ensure that the full suite of that programming is available. And I was in Mozambique a couple of years ago where those services were provided, and the community was very accepting of that. And so I think it will take time, but the work has begun over the last couple of years.
And I think our Minister Freeland's intervention yesterday will go a long way toward that. So the other thing that I wanted to bring up is this issue of interference in elections and in democratic stability by using technology, often by nefarious actors, sometimes state-backed actors. Are we looking at how to make sure that countries, that first of all Canada, that we have protections in terms of some of those organizations that might be based here in Canada, but how do we, when we're looking at development work, how do we counter some of the destabilizing impacts of organizations that might even be criminally funded, that might be trying to destabilize? The human rights defenders and democracy defenders are being attacked online. You've got journalists who the space for political dialogue is closing in many countries, and often it's not coming from that country, it's coming from outside, and it's being done through using technology. Are we looking at that when we look at our development assistance? Is there any thinking around that?
I think the thinking around that is probably a little bit broader. So in budget 2018, there was $16 million announced for cybersecurity. And an element of that is international. And so what Global Affairs will be doing is looking at coordinating international cyber activities. And, you know, looking at, and so there will be a dedicated unit to do that coordination internationally for us.
Thank you very much.